Hello everyone, you are welcome to today's class session. Today's class session. All right, we have a lot to cover today. And let me start by saying I apologize for not showing up last week, Monday. I had some technical challenges, so I couldn't come up online. And I seriously apologize for that, for those of us that we were waiting and I couldn't show up. Secondly, I would request that we schedule a time to meet and cover up for what we couldn't discuss last week, although we are going to cover that today, but that means that we are short of one discussion and I do not want students to be at the lost. So I'm kindly asking that we agree and meet on any other time that is convenient for the class, where we can have 1 hour of doing the presentation, the discussion that was supposed to take place last week and I couldn't show up for it. Please, I would seriously appreciate if we can agree. Any day, any time of the week, let's agree and have, because I really want to have 1 week of feedback with the students. So I don't want lecture to run throughout the semester without having 1 week or 1 session of interaction and getting question and feedback from the learners on what we have covered so far before your exam. So please, I'm expecting a feedback from you on agreed dates and time that is convenient for you to make up with what we lost last week. Thank you very much. Today, once again, I welcome you to today's class presentation. Earlier on, I've posted the PowerPoint instructional video on the VLE page, and I want to believe that students have been able to access it and go through it. Like I always say that this session is a facilitation, is not a lecture. And if it is a facilitation, learners are expected to interact with their facilitator. And the only way you will be able to interact with me is if you have gone through the materials that you have before the class session. So I always encourage, and I will continue to encourage you to please make out time to go through the materials that is provided so that you can have a full knowledge, an idea of what is going to be discussed during the class session, and you can participate. You see, class is interesting when learners are participating. It's interesting when you participate in the discussion. It makes it more interactive, which is very, very good. And so last week we were supposed to cover Unit 5, and this is week 6 of our facilitation, and we are on Unit 5 of NSC 303, and the title is Healthcare Resources, Monitoring and Evaluation of Health Services. And because this topic is a bit broad, so I'm dividing it into 2 parts. So we'll be covering resources and monitoring today, Then by next week when we meet, we'll cover the evaluation of health services. And so we'll go straight. It's 10 minutes past 5 now. I think others should join us. We can commence the class while others join. And so what do we mean by healthcare resources? We understand that healthcare resources, when we say healthcare resources, what do we understand? Let me start by asking questions to those of us that are live with me in the class. What do you understand by healthcare resources? Can you put it on the chat what you understand by healthcare resources? When you say healthcare resources in health system, what do you understand? What comprises of healthcare system? I'm waiting to see it on the chat. What do you understand by healthcare resources? I can see Yusuf, Joanna. What do you understand by healthcare resources? What comprises in your layman understanding, or in your understanding as a professional nurse, when you hear the word healthcare resources, what comes to your mind? Something should come to your mind. Is it manpower alone? Is it money? Is it materials? What do you understand by healthcare resources? Let's hear from you what you understand by healthcare resources. Joanna, Yusuf, I'm waiting to see response on the chat, please. What are your responses? You've gone through the instructional PowerPoint video. You've got your course materials. So let me hear from you what you understand by healthcare resources. Okay. Let me believe that you are still typing it, so I'll get the feedback. Simply, we have basic resources for providing health care services, and they are mainly human resources, money, as well as material resources. So those are the three basic resources that we will be discussing in this class. You have human resources, you have money, and you have material resources. And so in the next, okay, it comprises of manpower, money, and materials, promoting or to promote care for all, and it can be managed in delivering healthcare service. All right, very correct. Healthcare resources are consumable used in delivering healthcare. Good trial. Thank you so much. Thank you so much. So simply, like I was saying, that healthcare resources simply comprises of human resources, which is manpower. An example of that is you and I, that is the nurses, the doctors, and also it is important to understand that human resources is not only professionals, we also have the non-professionals like the auxiliaries. So in the context of primary health care, we have both the professionals and the non-professionals that make up manpower resources or human resources. Then we have money. Of course, money is power. What do we mean? Without money, or no matter how rich a country is, no matter how rich a country is, they need money to run their budgets. And money is always essential. And it is not always enough, especially in catering for the health budget of their citizen, of the community. And so we also have materials, and you will see it as we progress in this class. So these three essential resources cannot be overemphasized for us to have, or for any nation to run smoothly healthcare system, especially in the context of PAC. So for us, for any nation to run primary health care system successfully, these three essential resources are very important: the human resources, money, as well as material. And we are going to look at strategies and definition of manpower. What do we mean by manpower? Although I've explained to us that manpower is simply professionals and non-professionals that are available to deliver healthcare service to the community, to the people, to the nation. So we are going to look at that, and we're also going to look at monitoring versus surveillance. We are going to look at the difference between surveillance and monitoring as we progress in this lecture. And so let's get deeper into the lecture. We are going to start with strategy and definition of manpower, and I'm going to quickly share my slide, the slide that I have on that point with us. So, sorry about that. Okay. Okay, I'm sharing my, okay, let me also share the learning goal. At the end of the class, learners have expected learning goals that they should understand at the end of this class. And what are those learning goals? One is to be able to describe, to be able to measure the development, to measure and to develop human resources for health. You should be able to describe the measures to develop human resources for health. That is one learning goal that at the end of today's lecture, learners should be able to describe the measures to develop human resources for health. Two, list and explain ways of ensuring community involvement to be adopted in the Ministry of Health. Third is agencies engage in delivery of national healthcare services. And lastly, learners should be able to explain the action required to develop monitoring and evaluation process as managerial process for national health development. So you've seen the expected learning goal for learners at the end of this unit. At the end of this unit 5, yeah, we are on unit 5. So like I mentioned that resources are needed. Resources are needed to meet the many health needs of a community. No nation, however rich, has enough resources to meet all the needs or all aspects of healthcare of its citizens. That's very important. No matter how rich a nation is, the resources is not always enough to meet all aspects of healthcare of the citizen. And therefore, for that reason, we need an assessment of the available resources and proper allocation and efficient utilizations of the resources of a country needs to be considered for providing efficient healthcare services. And we are looking at it in the context of human resources, money and material resources. What do we mean by human resources? Primary health care has to mobilize human potential of the entire community. People need to be involved in deciding on the health system required by them and the health technology acceptable to them in delivering a part of national health program. This is to be achieved through self-care and family care and involvement in joint action for health. Health manpower constitutes a major part in human resources, so it is explained further in this study. So you have strategy and divination. Manpower includes both professional and non-professionals. I mentioned that earlier. And when we say health manpower requirements of a country are based on the following: the health needs and demands of the population. That is, the health needs in turn are based on health situation and health problems and aspiration of the people. Secondly, the desired output, which is prevention of disease, promoting well-being of the community, and curing of the disease, as well as rehabilitation of those that are already affected. And lastly, control or eradication of diseases. And so before we go further, may I see if there is any question so far on what we have covered on human resources. Are there questions? Are there contributions from what we have covered so far? I say it's made up of manpower, money, and medical materials. All right, thank you for your contribution. Any question so far from your side or contribution? Okay. All right. In the absence of no question, don't forget that class is still in session. I always encourage students to put on their video. It is essential because it's class. I see the student I'm facilitating. I see the student I'm facilitating. Please put on your video. All right, thank you. So we continue on the sector and the distribution of these resources. We understand that, especially in PHC, you have less manpower in the rural setting. And in the, I think it was in unit 2 or 3 or so, we come to understand that 80% of the citizens are in the rural areas, while 20% of the citizens are in the urban area, that is the city. But if you look at the resources of our country is largely located in the urban areas, where you have 20% of the population of the citizens of the nation, I mean. And so how do we juxtapose that? And so we've seen that there is maldistribution of resources in terms of ratio of the population, which I'm going to just share the slide that I have on that. You see, that's 20:80, and yet we have a lot of resources in the city where majority of the member of the nations are not settled. The healthcare system constitutes the management sector and involve organizational matters. which we are looking at the sector versus sector-wise distribution. So we have the public sector, we have the private sector, we have the indigenous system of medicine, and we have the voluntary health agency and non-governmental agency known as NGOs. When we say public sectors, what do we mean by public health sectors? We have the primary health, we have the primary health care centers, we have the general hospital, and you have the federal hospital. That is the settings or the sectors, the settings under public sector. Then we have the private sectors, you know, the private sectors, and we also have the indigenous sectors. What do we mean by indigenous sectors? You have those, the Aba traditional medicine practitioners. So they are also recognized. So, and you also have the voluntary and the non-governmental sectors. And so we've seen all these sectors, and we want to look at the subsection under each of these sectors. Basically, I've just mentioned to you 4 types of sectors: the public sector, the private sectors, the indigenous sectors, and the voluntary or the non-governmental sectors. Are there questions so far? Question or contribution so far? Okay. Okay, while you are typing your question on the chat or your contribution, I will share my slide on that point that I've just raised. Okay, we've mentioned this 4. So under private sector, you have the private hospital, you have the polytechnics, the nursing homes, and the general practitioners and the clinics. So under indigenous, you have the Aba medicine practitioners. I mentioned that. And one thing that I did not mention under public sector is health insurance scheme. Health insurance scheme is also a part of public health sector. And so we have under non-governmental agency now, we have the Nigerian Red Cross Society, Planned Parenthood Federation of Nigeria, the Leprosy Mission Nigeria. We also have professional bodies such as the Nigerian Medical Association, National Association of Nigerian Nurses and Midwives, Pharmaceutical Society of Nigeria, as well as National Association of Physiotherapists, Health Records Registration Board, as well as Medical and Health Worker Union. And we have missionary bodies. We have the Christian Health Association of Nigeria and Islamic Association, international agencies such as UNICEF and WHO, World Health Organization. And so that's what we have under a sector. That's what we have under sector versus distribution. And the next slide that I have is on rural versus urban distribution. I've briefly explained that we have more resources. When you are looking for more nurses, they are found in the urban area. When you're looking for resources, both human, money, otherwise materials, they are largely concentrated in the urban area compared to the rural area. And I've just explained to you that the 80% of the nation's citizens are living in the rural settlements, whereas it's only 20%. and yet the resources are concentrated where there are less people. But let's look at the reason why we have less manpower and resources in the rural setting. So maybe before I share my slide, can I have an idea of your thoughts on the reasons why people don't stay in the rural area? I mean the professionals. Now you post a nurse or a doctor to the rural setting. What are the challenges? Challenges for less professionals in the rural community, especially in the PAC. Let me share from your thoughts. Put it on the chat. Challenges to rural posting or staying. What are the challenges? What do you think are the reasons why we have less professionals in the rural settings? Kindly put it on the chat as we continue the lecture. I'm waiting to see what are your thoughts. What do you think? We are all practicing. What are the things that lack of basic amenities? Yes, excellent. That is one factor. That is one factor. Lack of health equipment, that's another factor. There are less resources in the rural setting. It's always improvising for this, for that. Lack of motivation. Yes, the government also are not motivating those that they post in the rural settings. And so, what are other things? Those are good points. Yes. Challenges of rural areas are bad roads. Okay. Yes. Bad roads. Yeah. Insufficient health facility equipment. Okay. The rural areas are not easily accessible. Lack of trained personnel. Okay. Okay. Security challenges. Thank you so much. Those are wonderful points. Lack of good schools for children. All right. Thank you so much. Those are essential points that a lot of health professionals put into considerations when they are posted to this rural area. And so we've seen this as a challenge. Why we have less human resources in the rural settings. So I'm just going to add to that point, I think a few of what is not available there. You mentioned, clearly, basically, the reason for maldistribution is chiefly attributed to absence of amenities, which you mentioned in the rural areas. Lack of job satisfaction, yes. Lack of job satisfaction is also one of the reasons. Professional isolation, lack of rural experience. Yes, many also are not trained primary healthcare nurses, and yet they are posted. And so they lack the experience and inability to adjust to the rural life by professional doctors and nurses. And so these are some of the reasons that make some of us, yes, lack of infrastructures such as light. So you have a lot of challenges that discourage a lot of professionals from accepting rural posting. But I'm telling you that if government can make these resources available, rural posting is one of the things that is enjoyable, because you get to have an interaction with the community people. And let me just quickly share this. I attended a conference, I think, 2018. It was on rural community nurses. And so not only nurses, professionals, but it's basically those who are in the rural areas of the part of the country that you are, where we come together and share experiences. What are the challenges we meet? We get there. Some of us came up with the pictures of the roads of the community we are serving. And you see, none of the participants were complaining. We were actually happy that we could serve community and we could impact them and we could identify challenges with them and we can provide services that is saving their lives. But there are parts that as professionals, it is beyond us. It is government responsibility. And so that's where government aspects has to come in. Like as nurses, we can't build the infrastructure. We can't build road. And so those are the discouragement. But if we are posted there, let's see how we can turn the situation around and still have our job satisfaction in the face of the challenges, seeing that we are saving lives. Because as nurses, we know that saving life is one of our priority. And so we'll move to the next slide, which talks about planning, planning and ratio in relation to population. I think we've mentioned that partially, that the health manpower planning is an important aspect of community health planning. It is based on series of accepted ratios, such as doctor population ratio, nurse population ratio, bed population ratio. And so we've seen that the population of a community, when the government are posting nurses and doctors to this community, it should be based on the population of the community, to the nurses, to the nurses, to the doctors, as well as the bed available in that community. And so we finish the human resources. Now we are moving to financial and material resources. When you say financial and material resources, they are as essential as human resources for successful implementation of the strategy. It involves efficient use of existing resources and as well as provision for additional resources. And so we've seen national health development plans in Nigeria. The first plan that we had in Nigeria was between 1946 to 1956. That was 10 years plan. The next one we had was for 5 years, which was between 1970 to 1974. And the third one was for 6 years, which was between 1975 to 1980. And the current one that we are still on with was planned in 1988 up until now. So imagine we are still using about more than 30 years, like 32 years planning. Then you wonder, why have we not reviewed our plan? So we've seen that even the government needs to review our national development plan. 1988 is a long time. It needs to be reviewed. But for educational purpose, we've seen that the last time our national development plan was put up was 1998. That's about 32 years. It's a long time. It's due for review. And so that's what the national, the financial and national development plan that we had so far. Are there questions so far from what we have covered? And so the financial resources and the GNP, what do we mean by GNP? It's simply gross national products. In Nigeria at the moment, we are sitting at 3% of GNP, 3% of GNP. Whereas in developed country, their budget for GNP is 12%. And in Nigeria, we are on 3%. But according to WHO, says that for any nation in developed country to provide health for all for its citizens, we must have, the nation has to be on minimum of 5 GNP. But at present, we are still on 3 GNP. So you can see that although we have this policy on paper, but the implementation is still a bit far from achievement. We have not achieved the goal, but we will get there. We'll get there hopefully before it's, yeah, we'll get there. So it's a gradual process. And so we have priority in financial allocation. Money and material are always scarce resources. Therefore, they must be put to most effective use with an eye for maximum output of results on minimum investment. And what do we need our resources, the money and the materials, to be used on? You see that we have some diseases, the communicable diseases. We have communicable diseases such as the whooping cough, yes, such as whooping cough. We need to spend money and resources on communicable diseases. An example is you spend money on your vaccine, you spend money on diseases that are communicable and they can easily be transferred from one person to another. And when you check all these diseases, they are concentrated in the rural settings. So our resources should be towards these areas for prevention and promoting health, as well as curative. So that is that. We've finished on human resources, money, and material. Are there questions so far before we move to the last segment of today's class, which is monitoring and surveillance? Question, contribution. I always say that this is not a lecture. This is not a lecture. Please always contribute, always ask questions. It's important. It makes the class interactive. So, what do we mean? What do we understand by monitoring? The next on my slide is monitoring and surveillance. What do we understand by monitoring? Let me have on the chat, let me share your thoughts on your understanding on monitoring. Okay, why I'm expecting to see? Okay, it's like I see someone says I have a question. Please ask your question. Just put your question on the chat. It will be read and answered. Ask your question, please. All right, while we are waiting for your question, let's Let me share my slide on the monitoring and evaluation. Don't forget, I'm not going to cover evaluation today. Evaluation will be in our next facilitation. And so, in order to know the progress in implementation of any strategy and to evaluate the effectiveness in improving the health status of the people, it is essential to set up a process of monitoring and evaluation. Success of any program depends on constant monitoring of its different activities by guidance of an inbuilt predetermined systems of monitoring and evaluation right at the stage of its inception. Therefore, monitoring process as well as evaluation complement each other. So what is monitoring? Monitoring simply means day-to-day follow-up of activities during the implementation stage. Why do you want to monitor and follow up what you have planned? It's simply to ensure that the process you plan are going as scheduled. It also means a continuous process of observing, recording, and reporting on the activities of the organization or project. It may be a project that you are monitoring. It might be an organization. Thus, monitoring consists of keeping track of the course of activities and identifying deviation and taking corrective action if any deviation occurs. So far, that is the definition of monitoring. Thank you, Yusuf. Monitoring means continue measurement, analysis, the activities. Here you want to measure and analyze the activities or the project you are going, that you have planned. Okay, I see a question here. It said, please, ma, what are the importance of agriculture sector, water supply, water, housing sector, and communication in relation to PAC? Like we said that, you know that to have good health, the community needs to have good water. Yes or no? It is yes. So that tells you the importance of water supply to a community. Not only water supply, but safe water supply in a community. Housing sector. Of course, when community do not have a good housing, what do we mean by a good housing? A well-ventilated housing. Then the family will get sick. An individual gets sick, it affects the family. The community is affected. Then the health facility is bombarded with sick people. So you also have agricultural sector. Nutrition is one aspect that builds the immune system of individuals. And so if the agriculture is poor, that means the feeding of the people is also will be affected. And when their feeding is affected, it means that their immunity is affected, then their health will be compromised. And communication, what do we mean by communication? Communication simply means you are empowering people to know how to prevent diseases, how to promote good health, and how to cure simple ailments. And so these are very important to PAC. In any primary healthcare settings, these are very, very essential. This has to be put in place. So I hope I've been able to answer your question. So far, that is the definition of monitoring. So we want to compare monitoring as well versus surveillance. We've just defined monitoring. What do we mean by surveillance? And so I'm going to share my slides on the meaning of surveillance. Surveillance, on the other hand, simply means surveillance on the other end. Okay, monitoring also means performance, and okay, Yusuf has mentioned that analysis to detect changes in the environment. You monitor to detect if there is any deviation in what you have planned. An example is monitoring of an air pollution. In any community, you can monitor the air pollution or the quality of water or the growth or the nutritional status of the children. And just like what you have now, I just explained to you, you can now see the importance of agriculture, the importance of housing, the importance of water to PAC. It's very essential. It cannot be overemphasized. It also means an ongoing health services. You want to monitor it. How is it going? So on the other hand, surveillance means that you are watching over with great attention and authority of the minute details in a situation. So there is a situation and you are doing a surveillance on that situation. It is a continuous scrutiny of the factors that determine the occurrences and distribution of disease and other conditions of ill health. Or it is a program that assumes any character or dimension. Thus, we have epidemiological surveillance, demographic surveillance, and nutritional surveillance. Before we go to the objectives of surveillance, you can see that you can do a surveillance on the demographic of a community. You can do a surveillance on the epidemiological epidemiology of a community, as well as the nutrition surveillance on this community. You can do a nutrition surveillance on it. What are the objectives of surveillance? The following are the objectives. One, to provide information about new and changing trends in the health status of a population. That is, the morbidity, the mortality, the nutritional status, or other indicators of environmental hazard. And also to provide feedback which may be expected to modify the policy and the system itself to lead to redefinition of objectives. So you want to get feedback on what is going on in that community so as to redefine your objectives. And lastly, to provide timely warning of public health disaster so that intervention can be mobilized. An example is when COVID-19 was announced. Immediately it gets to the nation, we're warned that, okay, currently we have this pandemic and you want to take precaution to prevent disasters. So, and lastly on that, we have monitoring is an essential part of the broader concept embraced by surveillance. It requires careful planning and the use of standardized procedures and methods of data collection, but can then be carried out over extended period of time. So it can be carried out over a period of time. So we've seen so far the healthcare resources, where we look at the human resources, and we also look at the money and materials resources. We also looked at monitoring as well as surveillance. By God's grace, in our next meeting, we would finalize Unit 5, which is healthcare resources, monitoring and evaluation of health services. So far, this is where we are going to end it today. I want to welcome question and contribution. I'm seeing a question here. It says, monitoring is a day-to-day activities. Yes. There is a question, it says, please, ma'am, can you expand more on demographic and epidemiological surveillance? Example of epidemiological surveillance is the current situation that we have now. When we say epidemiological surveillance, you want to look at what is this disease or virus, or what illness is outbreak, an outbreak of illness or an outbreak of disease. Then you want to look at, you want to monitor it. Where is it spreading? When did it come? How is it spreading? So that's what you look at. You are monitoring, you are doing a surveillance on it. That is epidemiology. And when you say demographic, you want to look at it. What age group is this disease affecting? So, and you can only do that, you can only get this part when you do monitoring and surveillance. That's when you will be able to get this parts. So that is demographic. I remember doing COVID-2 pandemic. They said, oh, I think during one, it was elderly. During COVID-1 outbreak, it was mostly elderly, the senior citizens of the country. They were badly affected. Then when the second wave came, oh, that it affected the youth as well. So you can see the demographic is changing from senior citizen, that is the elderly people, from 16 and above. Then it comes to youths. Then we are in third wave now. And they say, oh, this third wave is affecting children. You can see the demographic is changing. So that is demographic and epidemiological surveillance. So for them to be able to say it's affecting this demographic, this set of people, is because they've done a kind of monitoring and surveillance. That's why they are able to come up with that fact. Can surveillance be done on a daily basis? Yes. Surveillance can. Surveillance, will I say on a daily basis? It depends on what you are looking out for, because if you are doing a monitoring, if you are monitoring and doing surveillance, then surveillance will not be done on a daily basis, because you are monitoring, you are doing the daily monitoring. You get my point? So the surveillance will not be daily. You just do a survey, maybe once a week or once a month. But for monitoring, you have your human manpower that is monitoring it on a daily basis. It's checking the trend. So that is so far what we are going to cover for today. And I think if there is no question, we can call it a day. Thank you all. I appreciate your attendance. Please, the last week of this facilitation will be feedback. Please ensure that you have gone through all your materials. By God's grace, I'm going to update the VLE page so that you can have all your materials updated, and your assignments. You never can tell the one that I will pick from your assignment. Of course, I'm not going to use all the assignments, but because you are not in my mind to know which one I'm going to use and which one I'm not going to use. So I encourage you to please attend to all the assignments, please. And you never can tell, maybe some of the questions might come out in your exam. And don't forget also that the last week of this facilitation will be for feedback. And so we are going to discuss what area should you, what should you expect, what should you not expect. Anyway, I won't tell you what to expect and what not to expect, but come with your question, then we'll rub minds together. But I'm telling you, it will be very helpful for you if you make it. So please encourage your friends also to join the last session. I think we'll end it here. I'll see you next week, same time, same day. But please, I've also requested that you please agree on one day outside of Monday that we meet, where we can cover up for what we missed last week. Please, I will really appreciate. Send me a message or send me an email on the agreed date and time. Anytime, any date is convenient for me. Please, let's make up for what we did not cover last week. Thank you. Enjoy the remaining hours of the day. God bless. Bye.